hospice essentially means that we're treating symptoms of an incurable disease. So we know that someone's going to, at some point in time, die from this illness, and we're going to manage symptoms, and this is end-of-life care. A lot of people don't realize that we have a home hospice. They really think of us mostly as Pepe's house, but in fact, about 90% of our patients are on home hospice, either in their own home or apartment, a care home, an assisted living, or a independent living type facilities. From day one till the last day they're here, we are always working on clarifying and identifying what their goals are. So their goal might be, well, I want to be able to see my son, you know, that's in Afghanistan but is coming home in 3 months, or I want to be at home with my cat. Or their goal may be, I don't want to feel one morsel of pain, even if that means I'm not awake. Their goal may also be, I don't mind being a little bit painful as long as I'm coherent. And so we take the approach that this is their journey. We're sort of here to help guide them and assist them, but they get to decide whether, you know, how they want their journey to go.
The value of hospice in the home setting is that our staff can work with controlling the symptoms that prevent people from being available to their loved ones and have a loving exit. In the home, we can send nurses, our social workers, volunteers to provide the extra support that the family members need. So the conversations can be focused on loving goodbyes. The other benefit of home hospice is that we have 24-hour nurses on call, which means that at 1:30 in the morning, if a patient or a family needs support, they have a number to call and a person to talk to. One major burden at the end of life are the expenses of health care. The Medicare hospice benefit is free for patients and their families. And we in hospice will provide durable medical equipment, oxygen, as well as medications related to the terminal illness, all free. There'll be no bills arriving at the door, no paperwork to fill out, which can be a huge relief for families.
My father-in-law is under hospice care because he has congestive heart failure, and there is really nothing they can do. He will soon be 95, and there's really nothing they can do for him at this point. So he's accepted it, and he's at home, and the nurses are back visiting him, the social worker. So it's been a very good feeling for us, because it takes a lot of the burden off us that he's comfortable. There's so much that they offer in getting the right supplies, getting the medication, making sure the family knows how to administer the medication, making sure if they need a hospital bed, that they have a hospital bed.
We do our very best work when we get that patient at that 6-month mark. That's where we can really teach people, that's where we can establish relationships with them so that they trust us. That if we get them at the 6-month mark, then not every minute of every day is nursing care. There's still a lot of moments where they're just kind of sitting in front of the TV and watching their regular shows together, or talking about, you know, what their children are doing.
I think the one thing I would really like people to know is, number one, don't wait until hours before death. So many people are afraid to admit what might be happening, and there's such a level of comfort to turn it over to hospice, even if they're in a home setting, because of what they offer and the support, the emotional support, the psychosocial support.
I think everybody wants to pass at home if they can. It's familiar. You know, your friends can come by, your pets are there, and so it's just really a nice setting. So we have a generation of people that are now dying at home, and their children are seeing it. Their children are helping take care of them, or their cousins, or their spouses, and they see that it's not scary, and that it's, you know, we really can achieve a peaceful death in the home.